Diabetes is a chronic, lifelong disease. It can cause multiple health problems, and as our Arthur Gay reports, new information shows that it is also one of the most rapidly growing diseases of our time. He tells us what we should all know about detecting and controlling diabetes.
According to the Centers for Disease Control and Prevention, the lifetime chance of developing diabetes is now 1 in 3 for males and 2 in 5 for females. In New York alone, over 1 million residents have been diagnosed with diabetes, and the disease affects over 440,000 people right here in Alabama.
When I first found out, it was kind of, I guess, fear, uncertainty, not knowing exactly what was going to have to be changed.
Dr. Frank Thompson, retired forensic coach and professor at the University of Alabama, said after he found out, he quickly worked to learn more about the condition and how to live with it. Many are living with it and don't even know it. More than 23 million Americans have diabetes, and 6 million don't even know it. So a good place to start to understand this threatening condition is with a clear definition for it. Dr. Tawheed Kamal is an endocrinologist of internal medicine.
Fasting blood glucose of above 126 or post-meal blood sugar above 200 on more than 2 occasions.
Dr. Kamal says in the early stages of diabetes, there may not be any symptoms. So sometimes doctors don't find out about it until they do a biochemical analysis. That was the case with Professor Frank Thompson. He was diagnosed with type 2 diabetes when his doctor was running routine blood work.
And, of course, diabetes runs in my family, and my grandmother and 2 great aunts all had diabetes at different levels. And so, as I said, it runs in our family, so it didn't surprise me, but I thought I was going to miss that bullet. I'd never really had any kind of symptoms or feelings that I might be diabetic at all.
Dr. Kamal says some early signs of the condition may include increased thirst and urination. The disease can also impact the vascular structure of the body, increasing the risk of stroke and heart disease, causing blurry vision. In fact, some people first learn they have diabetes when they go for an eye exam. Dr. Carrie Bonds is an optometrist at Tuscaloosa Eye Care.
Sometimes you may have no symptoms at all. Sometimes you may see floaters in your vision. You may see wavy or distorted vision. But a lot of times people don't have any symptoms, and that's why it's important for every diabetic to have their eyes dilated once a year.
Bonds explains the eye exam is also a way to monitor the progression of diabetes in patients that already know they have it.
If we see some problem, then we may encourage you to come back sooner than your yearly exam, such as every 3 months or 6 months, just depending.
Bonds tells us some of the many eye problems affected by diabetes.
Diabetic retinopathy is a type of disease caused by diabetes. Macular edema is a type of disease caused by diabetes in the eye. Neovascular glaucoma. Also, you can have a retinal detachment.
But many eye diseases caused by diabetes can be reversed if caught early enough. And the good news is new technology is providing new treatment for those eye problems.
Sometimes we can give a shot of Avastin, which is a drug that can prevent neovascularization, which is the formation of those leaky blood vessels.
No matter how you first discover you have diabetes, the next step is to take the right steps in planning a comprehensive treatment strategy. Dr. Mulaney Murphy of the Wellness Center at Shelton State University.
First thing I would say is work with your physician in regulating your blood sugar. You have to create a support system. Your physician should be the first of that team.
And physicians say that in addition to monitoring blood sugar levels, patients should also be concerned about controlling their cholesterol and blood pressure levels. Again, Dr. Tawheed Kamal.
The guidelines for cholesterol blood pressure control is very important, and ADA has set guidelines which are much more aggressive than in patients who do not have diabetes. High cholesterol and high blood pressure in the setting of diabetes can lead to increased vascular complication, particularly stroke, and heart disease.
While regular testing for blood pressure and cholesterol is important, the testing of blood sugar is a daily factor of life for diabetics.
It really depends on the type of diabetes and the stage of diabetes. In a person who is insulin deficient or who has diabetes for a long time and who is on multiple medication, they will need to check their blood sugar about 3-4 times a day. If a person has diabetes that is reasonably well controlled, once or twice a day blood sugar can be sufficient.
And learning how to evaluate blood sugar is the first step.
Fasting blood glucose between 80 to 120 and post-meal blood sugar of less than 160 is the ADA goal. In some patients, it can be quite difficult to achieve. So we attempt to get as good control as possible and still try to prevent complication, particularly hypoglycemia.
Kamal says most patients will be able to predict low blood sugar when it happens and take corrective actions. But if hypoglycemia is severe, a diabetic can have a seizure or even lose consciousness and need immediate medical attention. So it is clear that controlling your blood sugar level is essential, but it's not always easy to do. But according to Dr. John Wheat, there are many medicines available to keep it under control.
The number one way to control diabetes is through diet and exercise and maintaining a good body weight. After that, there are various oral medications such as glipizide and sulfonylureas and glucophage and others that can be used, and those are supplemented at times with insulin so that one might use an oral agent or might use insulin and sometimes might use both in order to help replace the pancreas in producing the insulin needed to keep the blood sugar down.
And Dr. Frank Thompson says diet medicine are part of his plan to deal with the diabetes as well.
I manage it basically by medication now. Specifically, I take metformin daily, and that has, over the past year, helped to bring my sugar levels down. And of course, watching what I eat has helped also, reduced it to almost normal levels.
Dr. Mulaney Murphy also stressed the dual role of medication and nutrition.
Your physician should not only give you the medication, but work with you in helping you to understand nutrition. So setting you up with a nutrition educator like a registered dietitian to help one learn how to combine protein, fats, and carbohydrates in the diet, because that's instrumental in the formula.
And that helped Dr. Frank Thompson adjust his diet.
I didn't find it that difficult to change eating habits. I attended a class at DCH that the Diabetes Center offers. And, of course, I learned that obviously there's some foods that you clearly need to stay away from, but there are a lot of foods that, as long as you eat them in moderation, it's okay. It's just that we don't always eat things in moderation, and that's when it becomes a problem. So I was educated enough to find out that there's still a wide range of great foods, types of food out there that I can eat.
That education